My name is Tom Menighan. I will be the moderator for this session this morning, making sure that the right medicine is provided to the right patient. Under that title, we'll primarily focus our discussion on the appropriateness of pharmacotherapy and whether or not the treatment prescribed and provided is first the most appropriate, and then, of course, is the therapy dispensed, the intended therapy, by all collaborating health professionals involved in the patient's health. This is both a therapeutic and a patient safety issue.
So although we looked at all the aforementioned areas, we found 5 that are most relevant for all countries worldwide. And we believe that every country can implement action to improve medicine use along these 5 levers. You can see them listed here, and you can also see our estimate of the global impact on total healthcare expenditure that these have. About $62 billion from ensuring timely medicine use, $54 billion from appropriate use of antibiotics, $42 billion from preventing medication errors, $30 billion from using low-cost and safe generics when they're available, and $18 billion from effective management of polypharmacy.
How do I see the roles in the future of pharmacy? Roles are based on need. And as you can see, there's a shifting need, both globally and of course, in the United States, on pharmacy practice. The need is, of course, on responsible use of medication. However, the need is also on the responsibility to maximize each healthcare professional's as a resource to the country. Focusing on the pharmacist is appropriate in this situation. We are a very underutilized asset in many countries. Given our training and accessibility and education, it is very appropriate to consider that we should reframe a little bit the way we think about the pharmacist's role. Consider the pharmacist as a manager of the health condition with their expertise in medication management.
Pharmacists, medical doctors, and nurses should learn to work together and to share their expertise, forming a truly multidisciplinary team devoted to patients' best interest.
A few words on behalf of WHO on the role of the pharmacist and particularly within the healthcare team. As WHO, in fact, we are working in more than 193 countries with, of course, very diverse realities, health systems realities, but also very diverse health realities. And we need to look at the core functions of the healthcare team, and including the pharmacist, but also in relation to the overall healthcare environment. In WHO, for many years, we have been very actively working together with the pharmacist community to look at the role of the pharmacist. In the European office, many years ago, we produced the first book on the role of the pharmacist in healthcare, clearly laying the groundwork for developing that role and making that a much more broader and integrated role in the healthcare team. Finally, a point I would like to stress also is the need for research and monitoring to see how at practical level medicines are actually being prescribed, how they are dispensed, because if we can have good information systems around that, it's also easier to engage in discussions with the healthcare team on how we can further improve that.
I think the main role of pharmaceutical company is to contribute to human health by developing new innovative products and supplying constantly those high-quality products to the patient.
The Council of Europe and its EDQM have established a forward-looking program developing and implementing basic and advanced pharmaceutical care indicators, and would indeed welcome cooperation and information exchange with interested organizations and governments in the world.
When we look at improving the use of medicines, obviously the first goal that we are looking at is to improve health of patients. At the same time, I think it's clear, and many studies have shown that, both from low-income countries as well as from high-income countries, and also the case studies that Chris Virasuria presented, that irrational use of medicines, overuse, misuse, abuse of medicines leads to wastage. It leads to lost health. And obviously, the irrational use is the most expensive use of medicines. In principle, it's not an issue of reducing healthcare costs. It's about efficiency. It's about making sure that we cut out the waste, and that the money that is eventually freed up by that can be used for other important, needed, and cost-effective interventions in healthcare.
I see the future role of the pharmacist as being almost a clinician of chronic health or chronic conditions. The diagnostic part is such a short part on the timeline of continuity of care, and the burden of healthcare cost and resources needed are on the chronic portion of disease. So I think that's where the pharmacist has the biggest opportunity to make a difference in the healthcare system.
There is a lot to be done on the packaging because it's a very important element for a responsible use of medicine. It's a support of information. Packaging should be considered an essential part of research and development, and should be taken more seriously by not only pharmaceutical industry, but also drug agencies and regulators. The right medicine to the right patient means that the pharmaceutical industry should be more focused on the patients' needs and on shareholders' needs. For instance, there are too many Me Too drugs in some therapeutic areas, and not enough new drugs in some other therapeutic areas. Not only orphan diseases or neglected diseases, but also the lack of new antibiotics is a very public health concern.
What we clearly see over the last couple of years, that increasingly there is a drive towards expanding coverage of healthcare systems, to bring more and more of the population into a national system where funds can be pooled and where funds can be used according to those who need them. And I think that is really the importance of this growing drive towards universal health coverage. You see big countries, big emerging countries, including China and India, that are taking important steps towards expanding the coverage of their health system. And that is clearly one of the needed avenues that needs to be taken in order to increase access to medicines, because there is no system in the world where people privately would be able to pay for the drugs that they need. That would be simply impossible. So I think it's important that within that global development, that also the access to medicines and to medical products is clearly framed within that drive towards a universal health coverage for populations.
We cannot expect a responsible use of medicine by the patients without having informed decision-making that is shared between health professionals and patients.
I think there's three main things that we could help with the policymakers and decisions, and things that can be done at minimal to no cost, because that's always important to policymakers if it's not a cost to them, to improve care. And there's ample evidence out there that we could expand the role of the pharmacist, and simple things to support collaborative practice. Think about the cost of collaborative practice. It's really very minimal, and it's getting people to work together, and that's very important because we can sell that to a policymaker. The second thing is integrated access to care or health information. We absolutely need integrated access, because if we are the vehicles of change, we will need that roadmap. And the third thing is overall, policy should support all healthcare providers working at the maximum level of their licensure and education. And I think that's where policy can really drive change in matching with the needs currently of the health systems.
The roots for the problems are very complex. It's not just about individual doctors or patients or pharmacists, but it is about, it is about training, the way people are being educated. It is about the healthcare environment in which people are working. It is about the way money flows through the system. So if you actually want to do something about it, on one hand, you need obviously to work with the health professionals and patients in the field and look in terms of education and information and awareness. At the same point in time, indeed, you need to create that policy environment and that financial environment and that managerial environment that actually makes that happen, makes that collaboration happen and rewards improved use of medicines, etc. And I think that is clearly where we're struggling at the international level.
At the level of healthcare professionals, policymakers should implement a better use of current skills with, for instance, a widened role for pharmacists in close collaboration with medical doctors and nurses. It is also the responsibility of policymakers to ensure independent funding for the continuing education of healthcare professionals.
We've covered a lot of ground this morning. I'd like to thank the panelists for their time, talent, and insights this morning, and ask each of you to give them a round of applause.